Is it mandatory to prescribe antibiotics for non-surgical perio? Good question. Basically, no. Okay. Um, when we do the kind of, I know some of you are coming for the hands-on course, where we do the 5 days continuous. Some of these topics we come back to because one of the things we do on the hands-on course is we do some perio treatment planning exercises to kind of put it into perspective. And I know those of you who are interested still in the hands-on course, the next session we only have 2 places left. So if you do want to get one of those last 2 places, do let us know sort of ASAP, because the course is definitely going to fill up. With the perio, really antibiotics, you know, it's been in the press in the UK again this week about over-prescribing antibiotics. Really, antibiotics are for refractory or non-responsive cases. So you do your non-surgical, but you've still got bleeding. You've still got pockets that are not shrinking. Then you can use the antibiotics, but it mustn't be to compensate for lack of plaque control. So the patient needs to be 80% plaque free. They need to basically have not responded to the initial therapy as well as you hoped. For systemic antibiotics, probably use, if they've got, say, 8 or more pockets, 5, 6 pockets, use systemic, use metronidazole and amoxicillin. If there's problems with that, use doxycycline. 3 or 4 sites, the first line of defense would be the closite, the long-acting chlorhexidine gel. The other gel that I recommend on the lecture is, and the name escapes me, it's the doxycycline gel from Heraeus Kulza, and the name has escaped me. But if you check your lectures, that gel, if the closite doesn't work, I've used that gel, and crikey, I've had really good results with that in pocket shrinkage and reduction in bleeding as well. But if you go back to the lectures, it's the other gel that I recommend as the second line.